She's literally between visits. We caught her just at the right time. Her name is Nicole Dunn. She's from Empower Aged Care. You're going from one client to another, and we got you. We said, we've got a spot, come on in. Look, what I'd like to touch on today is the federal budget and how it's going to impact on health and aged care.
Yeah, certainly. So the budget was released on the 6th of October.
Yep.
What we've seen is that there's certainly been focus in, the key areas we would expect, such as public hospitals, aged care facilities, mental health, home care, primary health services. What we've certainly seen is that there's been record levels of spending in public hospitals, and that's through the National Health Reform Agreement and to the tune of $131 billion. And particularly with this budget, we've certainly seen a greater focus on mental health.
Okay, especially with some of the fallout from the COVID experience, which has battered not only Victoria, but has affected Australians right around the country. So do you think because of COVID, we've seen this, not spike, but this better focusing of monies in that aged care area?
Well, what we've certainly seen is that because of COVID, the budget has needed to put dedicated funding in towards initiatives and areas that have been significantly affected by COVID. So, for example, we've seen there's the COVID-19 residential aged care response. That was an area very heavily impacted by COVID. And the funding that's dedicated towards that program is certainly looking at strengthening the partnerships between residential aged care and public and private hospitals. It's around upskilling nursing staff, additional PPE, faster pathology testing, and that funding's also been used to develop the Victorian Aged Care Response Centre.
Is it a good first step, or is it a substantial improvement in those areas?
Look, I'd say it's certainly a good first step, but we know that with aged care, and particularly residential aged care, it's not just about responding to COVID, it's about responding to that system.
But I'm trying to work out, is it enough, or do we need to do more?
Look, I certainly think in the area of residential aged care, we need to do more because we know that with a Royal Commission currently going on, that there are a plethora of recommendations from the Royal Commission, and that's going to take more funding to implement that. We also know that we've got an ageing population. So, for example, by 2020, we need a threefold increase in current staffing levels for residential aged care. So I think
that's a big one.
It's big. It's big. So I think the budget is certainly responding to COVID with residential aged care, but we need to go beyond that. It's about bringing that system up to where it consistently needs to be, as per the Royal Commission, and then also responding to an ageing population on top of that.
Has it also addressed the home care that we've touched on 2 or 3 times? Or is that the next big thing that needs a huge investment?
Look, the government's invested $1.7 billion towards home care
Now that sounds
packages.
like a lot of money, but there are a lot of people involved.
Yeah, it sounds like a lot of money, and what they're reporting is that it's approximately 23,000 new home care packages, but we've got over 100,000 people on the waiting list. So whilst it seems like a lot of money, the reality is that older people are still going to be waiting a while for home care packages.
So if you're marking this, can do more.
It would be can do more for home care packages and residential care, but certainly in other areas such as mental health and public hospitals, better grade there.
What's the best way for people to seek help if they're in need, and this is an area that's affecting them a lot?
Yeah, so certainly, and I'm seeing many clients that are experiencing depression, anxiety, isolation. When there's not a pandemic, we've got about 1 in 5 people that are experiencing a mental health illness, and with COVID that's only increased. So the best starting point is certainly to speak with your GP. With the budget, what we've seen is that with mental health, there's been an increase in the number of Medicare-funded psychology visits that people can access. So previously it was 10 visits, and with the new budget measures, that's now doubled to 20 visits, which gives people a lot more continuity of care. To access that, it is through a referral from the family doctor, which is quite easy to do and quite commonplace for family doctors to do.
Are people still using technology to reach out to their GPs?
Yeah, they are. So Tele-Health has also been expanded with this budget. Originally it was brought in, I guess, as a COVID-19 measure.
Emergency,
So it was brought in as an emergency measure so people could access health services without needing to do it face-to-face. And what we'll see is that being a mainstream part of the health service now. And not only mainstream, but it's going to expand. So it's not going to be just a GP, a doctor that you can see through Tele-Health. It's also physiotherapists, occupational therapists, and psychology and mental health services.
From your position, being the professional, does this access to Tele-Health, this add-on, been a real boon? I mean, Lord knows, I can't believe that we needed an emergency of this nature to get us to start thinking that way. But it seems to have become a real catalyst for change, for the good.
Yeah, absolutely. You know, it means that sometimes, you know, health services are much more accessible to people that may not be able to get into their doctor for some reason, whether it be that they've, you know, got children and that makes it difficult. So it's certainly an add-on for people that are, you know, computer literate and might be time poor. It's also helping with things such as regular medication scripts, that can be done through more efficiently through Tele-Health and through medication and script delivery. Yeah, absolutely.
That's a real boon. Look, it's fascinating just how much can be done if there's a will, and it's just fascinating also to see how this emergency, this global emergency, has pushed, and it's also really positive to see so many agencies now realising that they need to step up, whether it's state government, whether it's federal government, but importantly, as you say, it is reflected in the new budget. And as they say, more to do still, but a great first step going forward.
Absolutely.
Nicole Dunn from Empower Aged Care joining us, and you will be a regular on The Informer.
Absolutely.
So we look forward to seeing you next time, not between visits, but in a more measured way. We'll talk about what's next, especially home care, because as you said before, the numbers are incredibly high, and we have people each year coming in and putting their hand up and saying, I don't want to go to an aged care facility, don't want to go to a nursing home, I want to stay at home. And I've told you about my mum, she's not moving anywhere anytime soon, despite what we think. So that's very, very important.
Yeah, it's a pleasure.
Thank you, Nicole.
Thank you, George.
Thank you. Nicole Dunn.